Snoring is a noisy breathing while in sleep. Snoring is a common condition that can affect anyone, although it normally happens in men and in those who are overweight. Snoring tends to get worse with age. However, snoring once in a while isn't usually a serious problem, but it becomes a nuisance to your bed partner. If you're a long-term snorer, you not only disrupt the sleep of your bed partner, but you also deprive yourself of quality sleep. Sometimes snoring can be a symptom of health conditions such as obstructive sleep apnea. If you notice that you are overly sleeping during the day or you snore loudly, your bed partner notices that sometimes in the middle of your sleep you stop breathing, please, it's very pertinent that you talk to a doctor so that you can figure out what the problem is and also come on with a treatment protocol. Virtually everyone is a victim of snoring. If your husband is not snoring, your wife is snoring, or the children are snoring. So please, when you get across this video, ensure that you share this video to your family and friends. So on today's edition of Know Your Health, I'll be talking about 6 causes of snoring and 10 home remedies and lifestyle changes for snorers. If this is your first time of coming across my channel and this is a content that you're interested in, please do well to subscribe, turn your notification button on so that you don't miss out. As a returning viewer, I want to say thank you for finding my video worthy to watch and sharing. Causes of snoring. Snoring occurs when the flow of air through your nose and mouth is blocked. And in addition, there are other several things that can interfere with airflow, including number 1, blocked nasal airways. Some people snore only during the allergy season and when they have sinus infection. Problems such as deviated septum and nasal polyps can as well contribute to your snoring. What is deviated septum? When you look at the anatomy of your nose, you will notice that there is a wall that separates one nose from the other. So when this wall is on the center, it causes a blockade of airflow and thereby resulting in snoring. Number 2, tongue muscle through your throat and tongues. Throat and tongue muscle can be too relaxed, and which allows them to collapse into the airways. There are many factors that can contribute to relaxing of your tongue and throat muscles, such as alcohol and drugs. If you are the type that indulge in alcohol and drugs before going to sleep, there's every likelihood of your tongue and throat muscle becoming too relaxed, thereby collapsing into your airways, blocking the airways and resulting in your snoring. Number 3, bulky throat tissues. Being overweight is number 1 reason why you snore. In overweight people, they have enlarged throat tissues, which causes obstruction of airflow, thereby resulting in snoring. In children, they have enlarged tonsils and adenoids, which also causes obstruction of airflow and results in snoring. So if you are overweight and you snore at the same time, so you should try and shed off some weight by involving yourself in strenuous exercise and cut back on calories intake and eat more protein, vegetable and fruits. Number 4, long soft palate or uvula. A long soft palate or a long uvula is a dangling tissue in the back of your mouth that narrows the opening from your nose to your throat. So when you breathe, this causes them to vibrate and bump against one another and your airway becomes blocked. So this is another important factor that causes snoring. Number 5, alcohol and drug use. Drinking alcohol or taking muscle relaxant before going to bed is also another culprit in causing snoring. Why? Because they cause a tongue muscle tone in your throat and tongue muscle, thereby relaxing them too much and collapsing them into your airways, thereby causing obstruction of airflow and resulting in snoring. So you should avoid drinking alcohol or taking muscle relaxant before bed. Number 6, sleep position and sleep deprivation. Studies have shown that sleeping on the back causes snoring. So the best sleep position is sleeping on the side and also sleeping with a pillow. Using a pillow will help to raise your head up, thereby preventing the collapsing of your tongue against your throat, which blocks the airflow that results in snoring. In sleep deprivation also causes pore muscle tone in your throat and tongue muscle, thereby relaxing them too much and collapsing them into your airways, which results in snoring. This sleep deprivation is normally observed in health workers and security agents who stays throughout the night in order to perform their functions optimally. So if you belong to this class, try and know how you can manage your sleep. 10 home remedies and lifestyle changes for snorers. Causes of snoring by banal factors such as sleep position can easily be treated using home remedies, and certain lifestyle changes can also help in treating snoring, including the following. Number 1, sleep position. Sleeping on your back can cause snoring by collapsing the muscle of your tongue against your throat, thereby causing airflow obstruction, resulting in snoring. So sleeping on your side is all you need to allow free flow of air into your throat and also help in reducing or stopping snoring. Number 2, get enough sleep. Ensure that you get at least 7 to 9 hours of sleep that adults need per night, per joint recommendation from American Academy of Sleep and Sleep Research Society. However, sleep deprivation can also increase the risk of snoring. This is because it causes the muscle of throat to relax, thereby making it more susceptible to airway obstruction. Snoring can also increase the risk of sleep deprivation because it leads to interrupted sleep. So ensure that you get at least 7 to 9 hours of sleep every day to have a quality sleep and also help in reducing or stopping snoring. Number 3, raise the head of your bed. Elevating the head of your bed by a few inches may help in reducing snoring by keeping your airways open. So you can use products such as bed raisers or pillows to get extra height. Number 4, use of nasal strip or a nasal dilator. A stick or a nasal strip is placed on the bridge of the nose to help increase the space in the nasal passage. This makes your breathing more effective by eliminating or reducing snoring. On the other hand, you can as well use a nasal dilator. A nasal dilator is a stiffened adhesive that is applied on the nose across your nostrils. This helps to reduce airflow resistance and makes your breathing more easier. Number 5, limit or avoid alcohol before going to bed. Consuming alcohol at least 3 hours before going to bed can relax your throat muscle, thereby making it susceptible to airway obstruction, which results in snoring. Alcohol can as well disrupt your sleep in many ways, so you should try and avoid taking alcohol before going to bed. Number 6, avoid taking sedatives before going to bed. Studies have shown that taking sedatives before going to bed can as well cause snoring. This is because they can cause your throat muscle to relax, thereby making it susceptible to airway obstruction, which results in snoring. So avoiding taking sedatives before going to bed can help in easing your snoring. You can as well talk to your doctor to see what your options are. Number 8, maintain a moderate weight. Overweight is the number 1 reason why you are snoring. This is because it increases the bulkiness of the throat tissues. And when the throat tissues are bulky, they cause relaxation of throat muscle, which causes obstruction of airflow, which results in snoring. So you should try and shed off some fat by involving yourself in strenuous exercise and cut back on caloric intake and eat more protein, fruits and vegetables. Number 9, treat chronic allergies. Allergies can reduce airflow through your nose and force you to breathe through your mouth. This can increase the likelihood of you snoring. So you can talk to your doctor to see options for OTC and prescription anti-allergy medications he can prescribe for you to take care of the situation. Number 10, correct anatomical structural problems. Some people are born with or experience a deviated septum. A deviated septum is a misalignment of the wall that separates one nose from the other. which restricts airflow. This causes you to breathe through your mouth, which results in snoring. And this can only be corrected through surgery. If this is your first time or coming across my channel and this is a content that you are interested in, please do well to subscribe, put your notification button on so that you don't miss out. As a returning viewer, I want to say thank you for finding my video worthy to watch and share it. I want to say thank you for your patience for watching my video up to this length. Please, if there is any video you want me to come up with, please always communicate on the comment section. I will respond to that shortly. Thank you.